It's a trend that's raising eyebrows. More and more young people, even teens, are turning to cosmetic procedures, and they're doing it in record numbers. Whether it's lip fillers, preventative Botox, or non surgical nose reshaping, what used to be considered something for older adults is now becoming mainstream among younger Canadians. Many experts say social media is playing a major role, with apps, filters, and influencer culture fueling unrealistic beauty standards. At the same time, there's concern over the lack of regulation and whether these procedures are always being done for the right reasons. I sat down with Dr. Abhishek Raut, medical director at Appletree Medical Group, for more.
Dr. O, thank you so much for the time today.
Hey, thanks for having me.
Now, what are the factors that are playing into younger people getting plastic surgery?
Well, I think one of the biggest powerful influences is social media. We've seen platforms like Instagram, TikTok, and Snapchat really putting forward a culture of self presentation. We have filters and photo editing tools, which are setting what many would consider unrealistic beauty standards. It's a phenomenon that some people call Snapchat dysmorphia. So, after a while, individuals are seeking procedures to look more and more like their filtered selfies. Another factor is we call the Zoom effect. So during the pandemic, many people had to see their own faces on video calls, which really heightened the self awareness that came with that. And an increased interest in facial procedures as well. There's also this growing belief in what's known as prejuvenation, the idea of starting aesthetic treatments early to prevent any signs of aging before they appear. So procedures like baby Botox, fillers, and non-invasive facelifts have become a bit more popular as well for people in their 20s and 30s.
And you did just touch on some of the treatments that are getting a bit more popular, but what kind of procedures are you seeing more young people getting?
What we're seeing is a surge in both surgical and non-surgical procedures amongst young people. If we look at the non-surgical, that's what we refer to as things like Botox and dermal fillers. And we're seeing a lot of that starting very early as well. Chemical peels and laser treatments, microneedling and skin resurfacing, teeth whitening and veneers would all fall into this category of non-surgical procedures, which we see a huge rise. For surgical, what we are seeing is rhinoplasty or nose reshaping, breast augmentation and reduction, liposuction and body contouring, and a lot of facelifts and neck lifts. But surprisingly, many young patients are opting for these to maintain a more youthful appearance.
And could starting these procedures at a young age have long term effects in the future as people start to age, on their skin, on their mental health, on their overall appearance?
Well, unfortunately, yes. So, starting procedures like Botox treatments at a young age can have long term effects. Some of them are subtle, some of them are more significant. So, Botox works by temporarily paralyzing facial muscles, which is going to help smooth out wrinkles and fine lines. But if you do it repeatedly over time, especially in your 20s, it's going to lead to muscle weakening or atrophy. So, that means these muscles are going to become less active and shrink from disuse, and that's going to cause some facial expressions or asymmetry over the years as well. Another big concern we have is skin thinning. So while Botox can make skin appear smoother and brighter in the short term, many dermatologists are worried that long-term use is going to reduce that skin's elasticity or thickness, and especially if injections are very frequent and not spaced out. And then, as you alluded to, there is the psychological aspect that we're very worried about. So starting young means committing to a lifetime of treatments, since Botox effects will typically last 3 or 4 months. So maintaining these results requires ongoing injections, and this can create a cycle of dependency, both physically and emotionally, especially if that motivation is tied to self-esteem or social pressure.
And how much of an increase in cosmetic surgery has there been in young people over the past few years?
I think what we've seen is a steady and very significant increase over the past decade. Globally and in Canada, 17 to 35-year-olds now account for about 27% of all surgical procedures in the cosmetic realm. And that's a huge increase from 20% from 2019. If you look at the American data as well, 66,000 procedures were performed on teens aged 13 to 19. So what we are seeing is throughout very young and even the 17 and 35-year-olds, a steady increase over the past 5 years.
And on the increase of teens getting cosmetic surgeries, are there any preventative guardrails put in place by plastic surgeons to prevent young people from getting it? And are there any age restrictions?
So there are several safeguards and ethical guidelines that we use there. Age limits and consent requirements are a big part of that. So, for instance, in Canada, the legal age for most elective cosmetic procedures is 18 years old. Although in certain provinces like Ontario, you can go to 16 years old with parental consent. For reconstructive surgeries, like correcting a cleft palate, procedures can be done earlier, of course, even as young as 5 years old if it's deemed medically necessary. There are guardrails also used by plastic surgeons. Emotional maturity is a key factor. So, surgeons often assess whether the young person has a realistic expectation or is emotionally ready for the procedure. And many surgeons, depending on the procedure, will require a psychological evaluation to help rule out any underlying mental health issues or external pressures like bullying or social media influence that might be playing a role here.
And this could be due to the guardrails that plastic surgeons are putting in place, but we're seeing more budget clinics popping up. Is that part of the problem when it comes to overtreatment or botched results?
We are worried about these budget clinics. It's a growing rise and concern. Really, the concern with them is if it's a low cost procedure, the question is, do we have non-certified providers? Do we have outdated equipment? Or do we have inadequate safety protocols? All of these are going to increase the risk of complications like infections, scarring, or asymmetry. And then sometimes it can get much worse as well. We have patients who can experience nerve damage, poor healing, and even require revisions there as well. A big part of this is also medical tourism, where many patients may leave Canada, have surgery done, and then come back. And then in our healthcare system, we need to fix these issues that have stemmed up from those other clinics. So, certainly, it is a growing concern.
Dr. Rowe, thank you so much for the time today.
Thanks so much for having me.